Buenos días a todos los que nos estéis escuchando, desde donde sea, desde España, Latinoamérica o incluso hoy puede ser que desde países de habla inglesa. Hoy es un día muy especial para EPSIS y tenemos el privilegio de presentar una entrevista totalmente en inglés con un profesional londinense de un talento inconmensurable. Soy Juanjo del Mas, psicólogo general sanitario jurídico forense, y hoy tendré el placer de presentar la realidad virtual desde el punto de vista de un gran terapeuta que lleva años aplicándola en Inglaterra, en la capital de Londres. Por ello, la entrevista de hoy será totalmente en inglés, haré el cambio dentro de nada y pido de manera adelantada disculpas para aquellos que notéis un poco oxidado mi inglés, ya que llevo sin hablarlo más de lo que me gustaría. Sin más dilación, cambio el idioma, and now we will be speaking in full English during the interview. Well, what you say about virtual reality? Virtual reality, or VR, as it is known in the English-speaking world, has become part of our everyday lives, extending far beyond entertainment into fields such as education, training, and of course, healthcare. In recent years, its application in mental health has opened new possibilities for assessment and intervention too, allowing clinicians to create controlled, immersive, and highly personalized therapeutic experiences, especially in treatment for some kind of patients. Today, we will be joined by a psychologist whose work in London is quite pioneering in the use of VR in the therapeutic and psychological world. Without further ado, I want to introduce everyone here and all of our audience to Mike Ward. Hello, Mike.
Hello, Juano. Thank you for the invitation today.
Well, no problem at all. How is the day there in London?
Oh, yes, it's quite cold today, as you can tell. Yeah, with the big jumper and the jacket.
From Valencia, yeah. The weather is quite cold there.
I'd rather be where you are.
I know that. Well, for those of you who do not know his profile, Mike Ward has a very experienced clinical practice which brings together modern scientific approaches such as neuroscience and CBT, physiological and lifestyle-based methods, including nutrition and exercise, and also mindfulness. Alongside these approaches, Mike integrates technology into treatment when it is clinically appropriate, using different devices and tools such as virtual reality exposure therapy and alpha stim devices to support clients, both in sessions and at home. In this conversation and this interview overall, we will explore how VRET is deployed in a therapeutic setting and the role it can play in the treatment of anxiety and phobia. Without further ado, we have the pleasure to present VRET therapy and its deployment in a therapeutic setting. The floor is all yours, Mike.
Thank you. So, welcome everyone. And first thing I wanted to do was just show you what pieces of equipment are actually used, just so we know when we're talking about this, we can actually see the objects. So what we start with is we've got a pad here that I can show you, and this just is an example of where a client would first come in, which is the waiting room within the VR. So my first step with the clients is to show them this pad so they can see what is on there and introduce them to it. So this is for me to use, and the client's equipment is this, which is the VR headset. So that is the battery pack at the back. It's very lightweight, and this is very lightweight in itself. And again, this is just adjusted so then when the client is ready and we've gone through various protocols, etc., this would then sit on the client's just on the bridge of the nose so they can be immersed within the VR. But the first step would be they can just go into a waiting room. We might just try a bit of gentle mindfulness where they might have forest glades, running streams of water, just to, so they can have a look around before we do any of the actual therapeutic work. So this pad allows me to be in control of what's happening within the VR experience for my clients. So there's various treatments on here, exposures to different scenarios, which we can talk about more in a moment.
Well, just lovely. I see it's really straightforward and comforting for the patient, so the experience can be as natural as possible.
That's it.
seeing these tools and thinking about how technology always gives us some edge over the traditional practice, what clinical advantages do you think virtual reality offers when compared to traditional exposure techniques in treatment, especially with anxiety and phobias, for example?
Most definitely. So part of the importance of any exposure is about habituation and decreasing the fear response, and also the client being able to have control about that emotional regulation with regards to the exposure. So with VR, compared to what we call in CBT terms is in vivo exposure, where the client, we've agreed about what the client is going to do outside in their actual environment, which is the in vivo exposure. There's lots of things to take into consideration with that, and in vivo exposure is really important because it allows you the flexibility of that environment about how it can change and what it can do, and that can help with the adaptability for the client to cope with that. The VR sits just before in vivo exposure. So in a sense, it allows us to control the environment much more easily. It's very much more defined, very much repeatable as well within the same situation to get that habituation moving and reduce the fear response. And also it's gradual. So it sits in a particular place before the in vivo exposure. So the clients are able to immerse within the VR and then maybe progress to VR. So that is some of it gives us an increase in accessibility. So the client can actually use that in the therapeutic room as they come in for their appointments. As in vivo exposure, they've got to try and find that time, place where they can do it, etc. There's also enhanced engagement, because what we can do is then within each phobia or situation on the actual pad itself. So say like for a driving phobia, it's not just being in a car. There'll be various contexts. So there might be 7 different hierarchies within the driving exposure. So therefore we can start very gradual. We can then change the context. We can increase the difficulty as the client progresses through the course of treatment.
I see. So there are several stages and levels so that the patient can adapt.
Yeah.
And Mike, I'm curious, how do you adapt this VR-based exposure to each individual's emotional tolerance, therapeutic pace, or maybe even the appearance of dizziness,
Yeah, it's really important. So it's sort of that all the questions sort of link through. So there's something around ethics there, dizziness, client safety. There's the other part about emotional tolerance, emotional regulation. And that forms the basis of assessment and ongoing review through the therapeutic appointments to just ensure how the client is emotionally regulating the nervous system. So in a sense, if we follow a model, we've got like stability. So there'll be assessment about how the client emotionally regulates, self-soothes, the support they have around them, and in a sense, their sort of tolerance of distress. So we'll talk about that. We might do some things to measure it. And from there, then that will indicate whether that client is ready for the VR.
I see.
And so it's about their safety first, their emotional regulation. We might talk about those particular protocols and interventions to help self-soothe and regulate. And then how do we deploy those into then the VR setting as well at the same time, so you can have a good practice with them first, know how they work.
Of course. Impressive. So
every
patient is really taken into account when deploying the technology.
Most definitely, yeah, and it sort of strengthens that therapeutic alliance because in a way it allows you to ask more questions. It engages more because I'll hand them the equipment to look at, and they've got a sense of autonomy, they've got a sense of control. There's a sense that, hey, I've got this is VR, I'm not in danger in the therapy room, as opposed to being outside in the environment on their own. There's much more stimulus for them. So it allows us that context to establish that therapeutic setting for them to look, play through the equipment, have sort of a playfulness with it.
Of course, and as you just said, it strengthens the bond between the therapist and the patient, which is crucial
That's
in
it.
the applying
Yeah.
of neurotherapy.
Gives
And
it gives another opportunity of discussion,
of course,
and curiosity. So there's a sense of like, there's quite novel for many clients. They've not seen VR before.
of course, I guess they will all be quite unfamiliar with this new technology.
Yeah, that's it.
And Mike, in which type of patients or just clinical conditions have you seen the most positive outcomes when using VR?
Yeah, so I would look at that across the specific phobia range.
Okay,
So
obvious.
phobic responses, yeah, because then we can really tie that down into a particular context. And then once we've worked out what that context is, we can then open that context right up to put a different hierarchy in, and then work through the distress tolerance for each of those hierarchies. Situational anxiety. So there may be different situations that sort of links in with social anxiety disorder, panic disorder, PTSD. So there may be certain situations, it might be about people, could be about places. There could be triggers in particular environments. So if that is, for example, public speaking or in a boardroom, the VR allows us to just sit in the boardroom or stand in the boardroom, so we can change the posture within there. And these it's real-time footage of people inside the boardroom, and we can make it very informal. They're dressed in, just like I'm dressed today, as in just casual clothing. They're all sat around the table chatting away, and I might ask the client to do like a 2-minute talk, 30-second talk, or just greet and say, hello, my name is, and introduce themselves. On the VR as well, you can actually change it. So they end up wearing suits and ties, blouses, etc. And you can make it really formal. The faces, you can change the expressions where they look really bored and fed up. So, the client is trying to talk through and everyone's sort of disengaging. So they're getting used to that tolerance of like people looking around, chatting amongst themselves.
I see.
And so we can really grade it.
Yeah, so you can like implement some recognition and playtime, to call it like that.
Definitely.
So that they can get comfortable with using the VR. It's quite clever. It's quite clever.
It is. The important thing is what it allows is in vivo exposure, quite often the client will be on their own doing the agreed protocol and then feeding back on that protocol. In the therapy room with VR, I'm able to observe how the skin changes. I can observe if they start to move more, if they go still, if I think there's a sense of quietness or they start to talk a lot more. It gives me more opportunity to observe and then ask questions about what the client is experiencing. It also helps to for the client to then maybe to begin to reflect on their emotional awareness, their physiological response. And they might say, I've got racing thoughts at the moment. I'll say, okay, what's happening in the body as well? What do you observe about the body? So we can just pause the VR. The client can then just engage with what's happening in the physical system. They might notice they've gone cold in the extremities, or they might notice that the heart rate has started to increase and breath rate has become shorter. And within that VR exposure, we can we have the opportunity to capture all of that information and gently start to just ask questions, engage in conversation around it.
I see.
Then that information from the client then allows me to ask more questions, or we might pause the VR for a moment and go, hey, let's do some self-soothing techniques. Let's talk about what's happening in the body. So you can learn about their physiology, their breath, and then return back to the VR and take some of that practice back in. So you can switch in between very easily. Yeah. As in vivo, I can only go on a client's feedback in that moment of time. Yeah. Yes,
in vivo you do not have that like introspective view or setting that you are talking about. It's quite fantastic.
That's it.
Mike, from your experiences working with VR in London and in England, every time new technologies or or new implementations into science appear, there are
Yeah.
always several factions, people who are against them or do not like to use them, and people who favor their use. How do you think there in England patients and also professionals perceive the use of VR compared to more traditional therapeutic approaches?
So I think that the traditional therapeutic approaches have been around for a long time. And a lot of, if we look at it very holistically and look at over time, technology has not necessarily been introduced within the educational setting, within the colleges and the universities. More so the universities, it is included. But if we look at the UK, when someone's going to embark on some training, they might start early counselling sort of education. And that will be more about the therapeutic relationship with the client, their own sense of self, etc., and the different psychological models, CBT, psychodynamic, etc. And technology is not necessarily included within the use of that. So there is an element there within that educational setting, it is changing. There are now modules on that about technology and what's available. It's a very personal choice about a way of working with a client group, and it's a sense of, some therapists just want to stay with the models that they use. Others think that it doesn't have a place and want to use the traditional methods. But I would say when we feel a level of resistance or uncomfortability about something, it's a great opportunity to have a look at what's that about, in that sense, isn't it?
Completely true.
And before any engagement with bringing it into a therapeutic setting, is look for people that are using it, the courses that are available. Just greet it with a curiosity to just, find out, fact find, hold the equipment, practice with other therapists using it first. Think about how that might then move into a therapeutic setting. What would it look like? How would you use it? How would you introduce it? And that's some of the training that would come along with it.
How important is curiosity in the practice of psychology?
Most definitely. Yeah, it's important. And I always say when you get a level of resistance or like to want to avoid, just bring a curiosity to that area when you feel ready and have a look. Most definitely.
You were also speaking before about the role of the therapeutic alliance and the bond between therapist and patient.
Yeah.
Do you think the role of that alliance is played differently when working with such immersive technology?
Can do. It brings another depth to it.
Of course, another layer.
Because another layer there. So what it allows the therapist collaboratively to work with the client to notice that emotional attunement. So can the therapist start to pick up on what's happening for that client? At best, only ever guess, but the important thing is then to ask the questions around what's happening, what they're observing. And that can strengthen therapeutic alliance. There can be another opportunity for empathy. The client might be given some feedback. It's an opportunity to say, I can hear how this is difficult for you. What would you like to do? You're respecting their autonomy. So again, it allows more conversation, more engagement, both at sort of thought level, psychological conversation, but also emotional attunement. So I think it strengthens the alliance there. Yeah.
I see. And when regarding VR, it's quite new, it's quite modern. So many times people talk about the ethical or moral limits when using VR, when transiting between the different uses and where's the limits. And do you think that are there or not ethical or clinical limits to the use of VR in treating anxiety and especially phobias?
Yeah, most definitely. So one is client safety, their tolerance,
of course,
with stress tolerance, priority. Yeah. Once we know what we're doing with that, it's around like things like motion sickness, their history of the presenting issue, their personal history as well around that. So that might be about levels of disassociation, psychosis. What we don't want to do is increase any more disturbance in that sense. So therefore VR at that time might not be used. So it may be that VR is used at a later point in that therapeutic time. And that's the important part, is working that out with the client, with their history, with their personal choices. But number one is, can they engage? Can they regulate? Can they tolerate that level of distress that might come along? But they're all the discussions before they even try the equipment on.
I see. Once again,
Yeah.
I think that probably brings huge strength to the therapeutic alliance and the work extensions.
So it's validating for the client, really, because they're able to express, there's more questions, so they can express and reflect more. Other thing to be aware of as well is motion sickness. So
I see.
We might only use part of the VR for could be 5 minutes, could be 2 minutes, depending on how the client feels within that setting. So the first one is just purely play within that setting. It could be a mindfulness scene, so they can have a look around, they can listen to the sounds and noises. Or if they want, they can just sit in a waiting room before they go into any particular area, and they can move their head around, they can stand up. And naturally, if they're standing up with the VR, we talk about the safety of that. So the chair is always behind them, so they can feel the back of their legs against the chair. They know where the arms of the chair are. They can sit down. We agree points of contact. So if there's a sense the client walks away from the chair, we've already agreed that I might place a hand on the shoulder to say, hey, I'd like you to take the VR off. Just see where you are first, and then just gently guide them back to the chair. So again, it's all about consent, and that's part of that ethical framework. Their autonomy, their consent of how they want the VR to work, how they'd like to use it. And quite often, once clients are using the VR, the novelty of it, they're more curious about it.
Yes.
Yeah, it just naturally engages.
That automatically generates an engaging feeling towards something new and quite modern.
Definitely. Yeah.
I personally feel quite fascinated by VR.
Oh, it is. Yeah. When you immerse yourself into it, you think, wow, how this can work. And quite often clients say, but Mike, I know I'm in the therapy room with you. I know, this stuff on the VR isn't real. It looks real, but it's not real. Is it going to have an effect? And it's like, well, let's stay with that curiosity and should we find out? And having that space for the client to allow themselves to have the experience of VR, because it's quite easy for the judgment to come in.
Of course. It's always there.
Yeah, when they have the actual experience of the VR, they go, wow, I didn't realize that my heart rate would start to come up when I was in this public open space and there's lots of people around. And it's like you went, wow, I didn't realize. So then we can then talk about what is happening in the brain with regards to VR.
Yeah.
And how they know they're in the therapy room, but the brain is saying, alert, there's some level of risk here with what they're seeing within the VR, because the body's responding with a stress response. So then we'll respond to that therapeutically. Yeah.
It's brilliant. And just out of my own curiosity, how did you exactly come up with your interest in VR and its application in the therapy room?
Well, I've always found I've had an open curiosity. So it's a bit like if I think about when I first started, I started with general counselling and really enjoyed it. And then I still enjoy it. And there came a part in time when I was thinking, this is just not enough. When we're talking about anxiety, treatments are needed, physiological, nutritional, etc., all across all those things. So every time I've looked at training, I've looked at, okay, what can add value and give a different opportunity for clients that want to come into the clinic. And therefore, it allows more choice about how they want to engage within that therapeutic setting. So we can have technology, we can have alpha stim, we've got the VR, we've got cognitive therapies, nutritional, exercise. So it's like, wow, what can we do across each part if needed in that sense? So just going into it with a curiosity is like, what other value can this add from a client group? Was the question I asked. Yeah, what could be different?
I see.
Yeah.
Well, I cannot speak for our audience, but I can tell my curiosity has just been incremented with this.
Oh, lovely. Yeah.
So I can see your vision quite easily. Just to start closing the interview, which has been really engaging and interesting, I want to ask you, Mike, which is a crucial question now.
Okay.
How do you envision the future of VR in not only psychotherapy, but in all kinds of health? And what kind of training do you think psychologists maybe should integrate to do it effectively and bring it to their clinical practice?
Yeah, it's really, really important question. So the important part of that is VR, I think, does have a future in a therapeutic setting. It allows more opportunity for the clients and the therapists as well to be able to work in a particular way. It doesn't replace anything. It's just another opportunity that sits in with what the therapist is already offering. So it gives them another toolbox to work with, is really important. I would encourage looking for training establishments about VR, or like some therapists have said, Mike, can I come and talk to you about VR? Can I come in and we can talk it through? How would you use it? How would you approach a particular session? What are the particular problems that might come up? And talking those things through. So just going through the action of becoming more informed. Some of the latest technology, you can start to look at eye tracking. You can look at galvanic skin responses, the stress response, heart rate monitors. So there's more information available if needed, and if the client wants to use those pieces of technology as well, to then go, right, let's look at heart rate increases. Let's look at stress response on the skin, things like that. So it can be tied in with VR at the same time. So there is
it gives also the notion of the importance of the physiological response of the body.
Definitely, yeah. And quite often, clients are aware of it, but they're not quite sure what to then do.
Yeah.
So it gives us that opportunity. And then training can be tailored to, like, well, what do you do from a physiological perspective? What do you know already? What can you add to that can help with your toolbox for your clients?
I see. Yeah. Well, it has been just lovely to speak about this with you, Mike. It's been a pleasure and an honor for me personally, and I'm sure the audience will surely love the experience of this interview and its content in full English too. Maybe not mine, which is quite rusty, but I'm sure
you're doing well.
Well, thank you. I'm sorry your soothing British voice will be received much better than mine.
So, thanks very much. I've enjoyed it. Thank you.
I think it's time to finish our interview, and I just want some time to thank you once again for your work in VR. I'm hoping we can implement this in Spain soon enough, especially here in Valencia. And thanks again for your time and your proficiency, Mike.
No, you're most welcome, and thank you for the invitation this morning, Pino. It's been a pleasure to meet you and chat this through.
Yeah, likewise. Thanks to all the audience too, and see you soon. I hope we can collaborate soon enough.
Thank
Bye.
You. See you. Bye.